simply getting people vaccinated.
Yeah, so, the curve represents infections, right? And so what are the things that we can do to prevent infection? So, yes, vaccination will prevent infection. And even if it doesn't prevent infection, it's going to prevent a certain percent of people getting sick and needing to go to the doctor. Always washing your hands. I always have to get that one in there. Not going to work and not going to school if you are sick. So what we call presenteeism, we appreciate the enthusiasm, but it's not a good idea for people to go into other crowded spaces if you're not feeling well. And then the last thing is, especially if you're someone at risk, if you're going into a crowded environment with high density of people, you really should consider wearing a mask, especially right now with community circulation going on.
I know those tests aren't free anymore, although they will make 4 of them free at the end of September, but when in doubt, probably test, right? I mean, it's the safest way. It's just a sore throat.
Yeah.
Maybe not.
It's no longer, it's just allergies. That's the one we most commonly hear. Yeah, nothing is no longer just allergies.
Yeah. We've talked about this before, the new formula. But how well will it do against the variants out there? And is the formula the same whether you go Pfizer, Moderna, Novavax? It's the same formula?
Well, it's a little different. So Moderna and Pfizer, they have the same main component, which is a KP2 component. Novavax went in a little different direction. They went in JN1. But they're all related. So we've used this analogy before of, JN1, is the trunk of the tree. And then the KPs and LBs, those are branches off of that trunk. If you're on that tree, there should be, we expect that you're going to have a good protection, but the answer is always, we'll see.
Yeah. Here's, I think, one of the biggest questions right now people are asking. When do I get this new formula vaccine? Do I do it right now when the surge is happening, or do I roll the dice a little bit, wait till maybe November, that way I get it when cases might peak up during the winter time?
Yeah, so that's kind of a nuanced question. So the first thing I would say is that if you have been recently infected or recently vaccinated with the previous formulation, you should wait at least 3 months. Okay, that's kind of just a standard rule. If you are somebody who's at high risk of a bad outcome if you get infected, and you're going to be in a high risk situation, let's say your job is a publicly facing job, or you're going someplace where you're going to be in a very crowded environment, you may want to consider getting your COVID, your 24-25 COVID vaccine now. For the rest of us, I'm pretty busy, like you're pretty busy. I like to do 2 things at once if I can. So I'm gonna wait till probably October and get my flu and COVID at the at the same time, because these vaccines do not last forever. They basically last throughout the season, 4 to 6 months. And so the later you can get them into the season, the longer you're going to have protection on the other end.
Okay, I got time to sneak this one in since you mentioned flu and COVID vaccine at the same time. Some people worry that's going to double the amount of effects I might have from it, if I get any effects at all. True or not, you can do them at the same time, but will it double the effects?
Yeah, no, I mean, I think it's a reasonable assumption. But what we have seen, and they've done lots of studies looking at this, the effects you get from flu, the effects you get from COVID, they're not additive. So whatever that experience is for them individually, that's what you can probably expect for that, getting them together. And if you have anxiety about doing that, fine, space it out. Get one, a couple weeks later, you can get the other.
Okay, Dr. Thomas, love chatting with you, getting caught up on all these things. Thanks so much for being in studio. Appreciate it. We'll talk again really soon. You know that.